Hello, everybody. My name is Shannon Bohannon, and I am going to present my oral case presentation today on a 55-year-old Hispanic female who presents to the clinic today to establish care. Now, for this little lady, she is we've noticed that she came into the fast care side of the clinic multiple times for multiple complaints of a UTI. Each UTI test that she had did test positive, and she was placed on several different incidences of various antibiotics to treat Augmentin, Bactrim, Cipro. The most recent was a week ago, and she was placed on Macrobid. So that is history of present illness. That is why she's here today. She wants to establish care. So the last time she was at Fast Care Clinic, we recommended that she find a PCP so that there can be a greater investigation into why she's having these frequent urinary tract infections. Obtaining a urine culture is not a possibility on the Fast Care side. They just do a urine dip, and so they just do that. They test for leukocytes, maybe some protein, a little blood, nitrites, and then they just treat accordingly. So we strongly suggested the lady come in and um, establish with an actual provider so that this can be resolved, hopefully on a long-term status for this lady. So that is why she's here today to establish care. So her past medical history, she does have a history of hypertension and, of course, the frequent UTIs. She does not have a past surgical history. She denies any previous surgeries. Her family history is positive for her mother has hyperlipidemia, hypertension. She does have migraines, and her mother has had lung cancer. Her mother is still living, and but she does have lung cancer. Her father has a history of a heart attack. She is social history. She does not smoke. She has never smoked, and she does not drink. She is married, common law married, and her husband, it should note, is here with her today on her visit, as he also reports that he has frequent urinary symptoms, and that will present itself as when we talk about our assessment and our plan. She has one child, the age of 34, and she denies any form of exercise or extracurricular activity. She has never used drugs. She denies any illicit drug use. She does not denies any mental health history. She denies depression or any kind of suicidal ideation. And she denies that she has ever received any kind of immunizations. She is allergic to penicillin. Um, Her current medications are the use of nystatin topical cream. She is using this in her private area on an as needed basis. So we will address that again in our plan, in our assessment. She takes ibuprofen 600 milligrams 3 times a day for hand pain. She takes losartan 100 milligrams once a day for her blood pressure. Her vital signs are 133 over 79. Her heart rate is 96. Her respiratory rate is 18. Temp is 98.4. Her O2 sat is 95% on room air. She weighs 188.6 pounds and she has a BMI of 34.5. She has review of symptoms. She's just feels really concerned about her inability to resolve her urinary symptoms. She wants to get these resolved on a permanent basis, and she is concerned about the uh, damage that these frequent UTIs could be caused. She wants to establish with somebody to help manage her hypertension, and she feels like it is currently managed and well managed under her current medication regimen. She's alert oriented and she is able to answer all her questions appropriately. She is Spanish speaking only, so we did have a interpreter with us to interpret all the information. Her skin, she denies any skin rashes or itching, denies any skin problems. Um, her head, eyes, ears, nose, and throat, she denies any vision loss or any vision changes, any ear pain. any sinus pain or nosebleeds. She denies any throat pain or difficulty swallowing. She has no mouth pain. She has good dentition, and she reports that she does go to the dentist regularly. She denies any neck pain or stiffness. She reports she has no problems with her lymph nodes. Uh, she denies any shortness of breath with exertion, denies any pain with breathing. She denies any chest pain or chest pressure, denies any feels like palpitations, any kind of feeling like her heart is racing. She denies nausea, vomiting, diarrhea. She has no abdominal pain. On occasion, she does have occasional urinary pain. She does have urgency and frequency. She has a lower abdominal pain in regards to the feel of pressure in the bladder area. She denies any hematological issues, denies any bruises, easily bruises. She's able to walk. She denies any weakness to her lower extremities, denies any difficulty with ambulation, denies any recent falls. Um, she has no numbness or tingling in her lower extremities, and she denies any headaches, any dizzy spells, denies any syncopal episodes, and she denies any depression. So her physical exam today, she does appear she is clean and well dressed. She is pleasant and cooperative. Like I said, she did require a Spanish interpreter, and she did answer all of her questions appropriately. Her skin assessment, she has no skin rashes. She has no lesions, no petechia or purpura. She does not have, she has good skin color and it's within normal limits for her race. Her head is normal cephalic. Pupils are equally round and reactive. Her ocular muscles are intact. She has moist mucous membranes. She does not have any erythema or swelling to her throat, and her eyes and ears are symmetrical. She has good dentition. She's not missing any teeth. No oral lesions noted inside of her mouth. She has her neck is soft without any masses or bruise, and no stiffness noted. She has no tenderness or edema, and no throat pain, no tonsillar edema, no cervical mandibular lymph nodes noted. She denies any shortness of breath with moderate exertion. Her lung sounds are clear bilaterally. No respiratory rate is normal. Her heart sounds are normal. Heart rate is regular. She has normal S1, S2, no murmurs, no rubs, no gallops. Her abdomen is soft, mildly protuberant. She denies any pain or tenderness with palpation, and her bowel sounds are active in all quadrants. Like I said, she has no weakness in her lower extremities. She has a steady gait. She has 2+ pulses to all extremities bilaterally, and she has no edema to her lower extremities. She does not have any CVA tenderness, and when that was assessed, no rectal exam was done, so she does have full range of motion to her extremities. Cranial nerves are intact, gait is steady, no neurological deficits. So our assessment today is going to be a disorder of the urinary system and her hypertension, with her differential diagnosis of either BV or trichomonas. The reason why we come to this decision is, I had seen her 2 times that I know of previously in fast care. So our concern was maybe with her husband also complaining of urinary symptoms. He actually said he was passing blood clots. So that maybe there was an STI that was being transferred back and forth to each other. So we decided we discussed that with her. We kind of addressed domain number 2 with patient-centered care, and tried to dig a little deep into her history, into her sexual history, into the history of her husband, to see if maybe addressing this and performing these tests and making a referral to an OBGYN for further testing to see if maybe this was an actual complaint, and try and see if we could resolve this for her. So the labs that we drew today were a CBC. We got a CMP a hemoglobin A1C. These are all new patient labs to establish care. A TSH. We did get a UA from her and get a urine culture on that as well. She was also tested for the chlamydia, the NAP test, and the GGT test. So right now we're gonna she just completed a course of macrobid, so we're going to not give her anything. We're going to wait for the culture to come back and wait for the other labs to come back. We did talk to her, developed a patient-centered plan of care for her to establish the root cause of the UTI, and rather than throwing a bunch of antibiotics at her and continuing on with this cycle that's just not working for this particular patient. And then if we can't determine the root cause of these frequent UTIs, we'll refer her to a urologist. And this visit, we're going to refer her to an OBGYN. Okay, thank you for listening.